Welcome back to my YouTube channel. My name is Dr. Andrean. I'm here in Phoenix, Arizona. I'm here to teach you, my fellow acupuncturists, my acupuncture students, about acupuncture. So, of course, I have been alluding to how much I love channel theory, and today I want to be talking about the next steps into learning channel theory. Channel theory was one of my favorite classes, and I think it was my favorite class because I knew my anatomy so well. And one of the largest pieces of channel theory is knowing the anatomy and understanding imaging and reverse imaging and mirroring and all of this jazz. All that goes hand in hand, okay? And this is going to be mirroring and imaging is going to be a way of treating pain versus the other aspect of channel theory is going to be how to treat systemic symptoms and how to create a balanced treatment. I think majority of people understand imaging and reverse imaging, mirroring, all of this lingo. We use it, we talk about it. What a lot of people don't understand is how to create a truss and a balanced treatment. We've already compared and talked about how we can diagnose through Zong Fu, and that's going to be nature and how nature can be observed within our body and our environment. So, our external and internal environment will be using heat, cold, wind, dryness, dampness, summer heat, all of that. And so, that's one comparison of like all of those elements and pathogenic environments went into the organs or those meridians. Compared to channel theory, this is going to be, we're going to be talking more about the bracketed picture that we talked about last week, the brackets of the organs, which make up the channel. So we have the meridian, and people call this the channel as well. So we have like our lung meridian, we have our lung organ, but then we have the brackets, which this is called the 6 channels. And so within the 6 channels, this is going to be referring to the nature of both of those organs combined. That's going to be a whole other video. That's a lot. Let's just keep it basic today, and let's talk about, again, imaging and mirroring. So first of all, mirroring is going to be if you see a hand in a mirror, you will see the reflection of another hand. And so when treating pain like this, somebody has thumb pain, carpal tunnel, you could use your other wrist and that could be treated. The nice thing about this is once you put a needle in, so let's say it's just classic carpal tunnel, okay, so PC7, you go opposite. You'd go opposite and go PC7. Remember, we're not focused on the acupuncture point, we're focused on like the ashi points, but nonetheless, that is where I'm pointing. So with this, once I have it in the opposite hand that they're saying that they have pain in, now I'm telling them, okay, move it, use it, grip, tighten, like whatever you get your symptoms with, do that movement, and then tell me, has it changed and where has it changed? Because now is it starting to come up into the elbow? Is it starting to go into the palm? Like things like that. Maybe the quality is just different. So maybe instead of like a sharp shooting, maybe it's just dull and achy. All of this gives us insight that like the body is shifting to heal. Okay? And that's all we're looking for with acupuncture is like to notice the shift and then continue to enhance it. So mirroring is very straightforward. You see a hand, you get the other hand. Any body part, we can do mirroring. We could say we see a hand, but now we could also say our hand anatomically is very similar to our toes and our feet. So even though you're not putting that into the mirror and getting the same thing, anatomically, it's actually very similar. So again, in our hand, we have all of our carpals, very tight little bones, which would be very similar to our tarsals. And then we get the metacarpals or the metatarsals, and then going into the phalanges. So all of the anatomy is like very similar. You can think about how you have both styloid processes. That would be very similar to the malleolus. We have two bones, radius and ulna, which would be imaging and mirroring to the tibia and fibula. And then again, we have one big bone up here, we have one femur. So all of this starts to be like, oh my gosh, the anatomy is like the exact same, right? We even can look at it based off of the joint types. And so we have a ball and socket for our shoulder and our hip, which those would be our images and our mirrorings. And then we could also do our hinge joints, right? So this is just a classic hinge, and our knee is a classic hinge. And then think about all the rotation our wrist and our feet get. So movement wise, they're actually very similar as well. So you can start to see all the similarities within the body. And if you can take it a step further, if you know your anatomy, and we'll just stick kind of basic right now, think about your shoulder and your hip can be intertwined, okay? So if somebody came in with shoulder pain, you could use their hip, and let's say it was gonna be like their deltoid was painful. You could actually use their glutes. So think about the deltoids kind of wrapping around, big thick muscle wrapping around this joint, and that's exactly what the glutes are to the femur and that joint. And so you could think about how your tricep is 3 muscles, your hamstring is 3 muscles. You can start to think about how just similar all the muscle and ligament anatomy is of everything. And so that would actually be a way of like helping you treat everything. And so that is still all within mirroring, okay, because they're very similar with the anatomy. They're mirroring the look of the same thing. So the most basic mirroring is you see a hand, you get the opposite hand. But then also you could see a hand and then you'd get the crossbody foot, okay? So that would be always crossbody for the most part. We'll get into exceptions, but typically you go crossbody. Okay, then the next thing that you can be starting to think about, because going back to the shoulder example, so my shoulder hurts, I could use my hip. That means now that I'm having somebody undress their shoulder, so potentially taking off their shirt, and then I need access to their glutes. So I'm also saying, Kate, and take off your pants and underwear. So it just starts to become like very revealing. And I would prefer not to do that. I would prefer other ways of imaging. So we have something called reverse imaging and mirroring. Shoulder to hip, elbow to knee, hand to foot. I could reverse one of those. And so now kind of think about like your hand is straight up. So now this would be my hip, and then this would still be my knee, and then my shoulder would be my foot. So if you kind of just like think about raising your hand, now those are all just aligned. So again, hip, knee, foot. So it doesn't image exactly the same, but you can still be using this concept and it still gets great results. So again, I use this as like one of my primary ways of treating. This is all within the mirroring and reverse mirroring, okay? Now going to imaging, this whole limb is your body. This is representing your whole body. This is going to image your whole body. So my elbow is going to be my belly button. That's going to be my midline. Okay. And then this is going to be, I could either have this as my top of my head or as the bottom of my feet. And then it's going to go all the way down, again, top of my head, bottom of my feet, whichever way I want it to be. This is always going to be my belly button. So that's just like one way of imaging, which if you think about that, starts to get kind of cool because Again, pericardium 6 is known to open up the chest, relax the heart, calm the shen, all of that. And so if this is my belly button, my elbow is my belly button, and this is the top of my head, PC6 kind of images the head, right? So belly button kind of coming up. Both of those are going to be fantastic. Into even pericardium 7 can be used more for the throat. So then, yeah, this could be our neck, which now all of a sudden lung 7 is making sense of why it's such a great point for the nape of the neck. This is our face, which we use all the time for congestion, headaches, any of that. And so it just starts to be like, oh my gosh, the point energetics are aligning with the mirroring and the imaging. And this is starting to tie in and emphasize how all of these can be used together. Okay. One of the great things is talking about headaches and thinking about this as our head. So this is going to be the very top of the head. This is going to be my nose, and this is going to be the back of my head. So if you see this image, then all of a sudden the headaches, specifically we're talking about headaches here, align perfectly with how my hand is. So this is my lung, and the lungs open up to the nose. So that's why it is my nose. And then we can say that this is my large intestine, and people have the Yang-Ming headaches on their forehead. So my nose to my forehead. This is my Jue Yin, and when you have a headache, you have it on the vertex. So this is why it's the highest point. This is going to be your gallbladder or your Sanjiao headache. So this is going to be like the side of the head. So this is going to be the temples. And now we're moving to the back. So now if you have an occiput headache, then you could be using like your SI3, maybe even SI5, and you could be treating the occiput and helping relieve all of that. The same thing goes with the feet. Ultimately, all of this is going to just be tools for you to be able to do imaging and mirroring. And this is again just going to be for pain that is in the meridians and in the organs, compared to another aspect of channel theory will be creating a balanced treatment. And that's going to be much more complex, and we will build up into that. So some people too, like will say, so again, classic full body image is your whole arm. Again, I try to do everything from elbow down, hussies down, right? And so now you can actually just cut that off and say, okay, from just my fingertips to my elbow is going to be the top of my head to my feet. So again, now my, just like the middle of my wrist, my forearm, so maybe around PC4 is going to be my belly button. So you can just, I don't want to say make up, but if you can start to see the image of it, then if you look at the energetics, they typically align with how you can be supporting the body. So now that's my belly button. Again, PC6 can still be used as my chest, and then coming up is still all going to be working. And you could be using, again, full arm, half the arm, full leg, half the leg. You could be doing opposites. You can be doing cross bodies. There's so many aspects to all of this. And so majority of your patients should be leaving with much less pain than when they came in to see you. So I think that this is a good spot to wrap up. I'm going to have all of these pictures up here for you. So screenshot those, use those in your studying as well. And then get ready to be talking about the brackets of the channel theory, because ultimately all of that is going to be honing in and re-describing how each organ has its own functions, but now the organs together also have very similar functions to enhance every organ. It's so good. It's so good. So I hope you guys have a great week. I hope you guys are studying, and I hope that this was another piece to your puzzle and you can see the whole puzzle coming together. And leave a comment, subscribe, and I will see you soon.